All right, today's lesson is on patient education. Here's everything you need to know as a nurse. Now, this topic really falls into a variety of nursing courses. This can cover things like nursing fundamentals, community health, med-surg, and really patient education is something that covers all aspects of what we do as nurses. So no matter what class you're in, let's go ahead and get into it today. There are 3 goals for this lesson: to define and describe the concept of patient teaching, explain the theories and models which support patient education, and then apply those theories and models to the nursing practice in patient-centered care. Now use these 3 learning goals as a checklist to make sure that you got the most out of this lesson today. So let's go ahead and define patient education. According to Marshall, patient education is anything that provides patient and families with information that enables them to make informed choices about their care, their health, and their well-being, and that helps them gain knowledge and skill to participate in care or healthy living processes. Now, I encourage you to pause here and highlight or write down just the most important words that are coming out of this definition for you. Now, there are 4 different self-care and behavioral change theories and models that help inform patient education. The self-care theory is by Oram from 1985. And her theory says that self-care should be a baseline. Patients should be able to take care of themselves. And our job as nurses is to intervene with education and training to help patients care for themselves. Now, sometimes patients aren't able to care for themselves: newborns, patients who are disabled, patients who are critically ill. And of course, additional nursing support is needed for those who are unable to care for self. But really the goal here is equipping and educating patients to be able to take care of their own bodies. The second theory or model is the health belief model. This model really focuses on individual motivation to make changes. And this motivation can really predict whether those changes will happen. This model also looks at the patient's perception of threat or perceived benefit to the change. Do they really think that this is something that's going to hurt them and harm them? And do they see the benefit of making the change in their life? And this also factors in things like modifiable cues or factors. So if someone got a text every day at 9 a.m. to remind them to drink water, that would be a cue that might help them in making that change. The next one is the health promotion model. Now, this one is similar to the health belief model, but it also incorporates self-efficacy. Self-efficacy is the belief in oneself to be able to make the change. Does the person trust in their own ability? And it also looks at positive influences needed to make the change. Positive influences of the individual, of relationships and interpersonal, as well as the situation and environment that they find themselves in. And finally, the trans-theoretical change model outlines these 5 different steps to making a change for your life. Pre-contemplation means not even thinking about the change yet. Contemplation means contemplating it, thinking about making a change. Preparing means getting your life together to make that change. Action is when the change happens, and maintenance is when that change is sustained for greater than 6 months. And of course, at any stage of this model, there are risks for relapse. Now, there are a number of learning-specific theories that help guide patient education, and we're going to talk about each of these now. The cognitive learning theory. This is thinking about your thinking. It's about the patient's thought process. We're encouraging the patients to ask questions and to self-reflect on what they've learned. The more people are aware of their thought process, the better they can learn. Cognitive learning theory. The next one is the behavioral learning theory. This one says that learning is influenced by external factors through positive reinforcement, incentives, and rewards, and seeing others around you. The constructivism learning theory. Think about this being like Legos, and learners construct those Legos. They construct knowledge, linking previous knowledge together with new knowledge, and building a framework of knowledge for themselves. Now, the social learning theory has 3 factors of learning: personal, environmental, and behavioral. And this theory says that learning happens by observing others and that behavior is modeled. Now, the experiential learning theory says that learning comes from real world experience, lived experience out in the world. So this is why things like internships and volunteer opportunities are important for students and clinical experiences. The experiential learning theory says that retention increases with lived experience. So the more time you can spend in the real world, volunteering, clinical, sim lab, it's going to help you learn. The next one is the transformative learning theory. This one says that thinking is not static. In other words, one's thinking can change as new information comes into their life. And new information can actually influence change thinking patterns. One thing that helps to make this change is reflection on past experience and bringing that information into the present. And finally, the humanistic learning theory. This is an idea of holistic learning. The psychological safety of the learner is important, making sure the patient feels safe, both mentally and physically. And the educator is a facilitator of learning. And really, finally, the connectivism learning theory. It's similar to constructivism, except it puts a strong emphasis on technology as a source of learning. This is someone's ability to see connections between fields or ideas and recognizes that learning is dynamic. And recognizing also that the right answers for today could change in the future as new knowledge is attained. So when we look at patient education, there are 3 goals for patient education. The first is changed behavior. The second is to enhance health and well-being. And the third is to improve treatment of illness. And so depending on the learning that you're trying to accomplish with your patient, you may be working for all 3 of these goals or maybe just 1 or 2. Now, there are a variety of delivery methods for patient education. Instruction can be self-directed on things like online modules or websites. There can be formal classes, which can take place in person or online. And then most commonly for us as nurses are those one-on-one learning encounters with our patients, where we're providing discharge instructions, teaching about a new medication, teaching how to use a new inhaler, all of those one-on-one, just-in-time trainings that happen with our patients. Now, learning happens in 3 different domains. And when you are educating a patient, you want to consider which domain or domains are being used. Psychomotor are hands-on skills, things like giving insulin shots or taking a blood pressure. Cognitive domain is learning new information, the attainment of new knowledge. And the affective domain is a change in heart, a change in motivation, a change in belief. Learning styles can be divided into visual, auditory, or tactile kinesthetic. So do you learn best by seeing things written down, maybe in pamphlets or online? Do you learn best by hearing, which could be by videos or just oral instruction? Or do you learn best by tactile kinesthetic, doing something with your hands? Here are some essential tips for patient education. Number 1, use credible internet resources. It's important that patients are getting accurate information. Number 2, plan your teaching. Just like we plan all of our care for our patients, what we plan to say and what we're trying to accomplish is really important. And that goes along with deciding your goal. All learning should have a goal. So what's the goal? Is the goal that the patient understands the importance of consuming less salt in their diet? Is the goal that the patient understands how to insert their continuous glucose monitor? What's the goal? What do you want to get out of it? And then finally, determine the patient's motivation to learn. A demotivated, uninterested patient is going to learn a lot less than someone who is ready to make a change. So assess your patient's motivation. The next couple slides, we're going to talk about learning helpers and learning crushers. So some things that help learning happen is if the patient perceives the benefit. Do they understand why it's good for them? If we repeat things, if we teach in an undistracted, quiet environment, if we're supportive in our interaction and we're patient and we're not judgmental when they need us to repeat something. Patients are not going to ask us questions if we looked rushed and uninterested. Learning helpers can also be things like enhanced health literacy. Health literacy is a completely different video. I'll link it below, so make sure you check that one out after this. And finally, resources. Patients don't remember everything we teach them when we're in front of them. So send them home with resources that they can look at later that are easy to understand or within their literacy rate. Now, here are some learning challenges or learning crushes, things that really squash our ability to teach our patients. If the patient is in pain, if they're having fatigue, fire hosing them with information, distractions in the room, if they're depressed, if they have a lack of motivation and are uninterested in making a change, if they have any physical or cognitive deficits, which may impede their ability to learn, or if us as nurses, if we just don't know what we're talking about. So we need to make sure that we feel confident in what we're teaching before we go teach it to someone else. And guess what, everybody? That's okay. We don't know everything. And so be willing to learn yourself and look up the information and have a plan before you talk to the patient. Finally, the nursing process applies to nursing to patient education. When we're assessing our patient education, we're going to first assess the patient's current knowledge and their current health literacy level. Then we're going to diagnose what their learning need is. Now, this isn't their medical need. This is what do they need to learn from me today. We're going to plan a teaching strategy or a goal. What do we want? How do we want to tell them what they need to know? How are we going to approach this? Then we're going to finally teach them and then evaluate. And we're going to check to make sure that they actually understood what we said. And we can evaluate using things like teach back, having them tell us back the instructions. We can provide feedback when they didn't quite get something right. We can clarify that for them. Or we can ask for a return demonstration if the skill we're teaching them has some sort of hands-on psychomotor component. That's going to wrap it up for our chat on patient education. Thanks so much for studying with me today. And remember, as always, you are smart, you are capable, you are loved, and you got this.